Hello, I'm Dr. Patta Radhakrishna. I'm a Chief of Gastrointestinal and Laparoscopic Surgery at SIMS Hospital, Vadapalani. I shall talk to you something about hernia. Hernia is a common disease, and hernia is something where intestine from inside the abdomen will be protruding through one of the orifices in the abdomen. And these orifices, there are about 6-7 places where the abdominal wall is weak, which includes the umbilicus. When we find a protrusion there, it's called umbilical hernia. When you find a swelling in the groin, it's called inguinal hernia. And in a few other patients who underwent surgery for some reason, and from the surgical scar, if there is a protrusion or a swelling which becomes bigger and coughing or straining during stools, is called incisional hernia. These hernias are problematic because in due course of time they increase in size, and at some point of time they cause sudden problem like the intestine jutting out but not going back into the abdomen, causing obstruction. That be a major emergency. So anybody who has this hernia, whether it is in the umbilicus or in the groin, should see their surgeon, and surgeons will investigate and they will suggest surgery. And surgery is in the form of mostly in the form of laparoscopy, where keyholes are made and we enter the abdomen, and by seeing through a telescope we can make out where exactly the hernial orifice is from inside, and we will put a net there. It's called a mesh, and if that is done, the patients will become all right. And this particular thing of laparoscopic surgery in our center we do is at daycare. Daycare is something where patients get admitted in the morning, get their operation done, and by evening they are home. And this is a relatively painless procedure because many are scared that the mesh will cause problems and is a foreign body. It generally doesn't. Majority of the times, if done in very clean and healthy surroundings and proper protocol, these things do not happen. So anybody with an inguinal hernia or an umbilical hernia or a ventral hernia should see their surgeon, get investigated, and have to undergo treatment before they become a problem or they present as an emergency. Laparoscopic surgery is very safe, and most of the times the hernia is cured forever. Thank you.